it needs to just the general
To prevent medical malpractice cases. Because most of the cases that happen back in the day, pediatricians were the last people to get sued, never got sued. Fast forward 25 years, 30 years. Oh, geez. They'll sue anybody just because maybe it's the lottery. And usually, I've reviewed a lot of cases, and usually, somewhere along the chain of events, somebody said something. And it's that sentence that somebody said that triggers, maybe I should sue this doctor. And then everything starts. If people just are careful in the words that they use, they could prevent a lawsuit, even if
But
there
it's
is something bad and devastating.
but it's only only that you use. It's your body language, which we are not trained and we are not aware because it happens so fast. The amygdala and your body language works on nanoseconds.
Yeah.
And our brain, our frontal lobe, our thinking ability works in minutes.
Yeah, like George is exactly right. I do a significant amount of work for malpractice companies, doing some training of their physicians, but also teaching them in keynote lectures, etc. How do you communicate to build trusting relationships? The American Bar Association said many years ago in one of their conferences that patients are reluctant to sue for physicians they have a relationship with them. And the title of the little paper was "Stop Wasting Your Time." In other words, don't call up that patient and say you had a bad outcome. And there's a study at the University of Florida, Gainesville, that showed that you can build a relationship with a patient in 56 seconds. So we're not talking about long-term relationships here. We're talking about how you smile. Our brains are assessing someone's body language 3 million times a second. That's crazy. And so by what we teach physicians how to do is build that relationship, especially emergency room doctors. How you smile, how you sit down, your tone, your inflection, your cadence, et cetera, all make a huge difference. 81% of malpractice lawsuits name communication as one of their top three reasons for suing. And 90% of lawsuits are won by the physicians. If we can somehow get patients to not sue just because they're mad or because they feel that their questions weren't answered, just think about the financial ramifications that would have on healthcare and saving in malpractice, frivolous malpractice lawsuit.
So I know you don't like the role playing, but we don't have the time or the money to actually have actors today. I was going to go through the steps as you have taught me and use George as the dad of the patient.
Okay.
And it's not perfect, but it's better than nothing. I'm going to tell George, as a parent of a 2-year-old, that his child has been diagnosed with diabetes. And so I'm going to come into the room as you taught me. I am going to adjust my chair to be closer to George. And I'm going to sit down and I'm going to put my hands like this because this means I care and I'm in a tripod position. And this is how I'm preparing to deliver this news to George. And so, George, thank you for coming in today. George, as in our practice, we screen every 2-year-old for anemia, lead levels, and autoantibodies for diabetes. Your daughter's blood level is normal. She does not have anemia. But unfortunately, she did screen in for diabetes.
Wow. What does that mean, Doc? I don't understand.
We know now that diabetes can be diagnosed early before you need insulin. And so we like to know that. So right now, it doesn't mean very much. And what I mean by that, George, is that I would like for you to allow me to make sure I have the diagnosis right, repeat the test, and I'm sure that you have had a A1C level measured at your internist at one time or another.
Yes.
So I'd like to get those 3 tests done today to make sure that your daughter is not in need of insulin and that she actually does have diabetes. Is that something we could do?
I guess we can do that. We'll have to call my wife because I want her to be on this conversation also. Maybe we could do it next week.
I would really like to get that A1C done today to be safe.
Okay.
Then when the A1C will come back within a day or two. Bodies take 7 to 14 days to come back. And then I wonder if we could have Delia and you come back in, if they're positive, and we can talk about what we need to do together.
If the child has diabetes,
Please,
he's going to be on medicine for the rest of his life.
not initially,
Is the
George.
kid really sick? Is he going to be hospitalized? Oh my God.
We're going to try to prevent your daughter from having to be at the hospital at any time. And we're going to count on some wonderful pediatricians that I am friends with, both at Nicholas Children's, like Dr. Bustamantes, or in Denver, where they're the national experts on diabetes for children. The first step is to make sure we have the diagnosis right, which we always do.